Welcome, everybody, to another episode of Inside the Psychopathic Mind podcast. Again, this is Jason Smith with Carl Giacono. And in today's episode, we're going to be talking about better assessing psychopathy with specific psychopathy criteria. For those watching at home, we're going to be putting up some criteria from Hervey Cleckley and Bob Hare, both in the Mask of Sanity for Hervey Cleckley and the PCL-R for Bob Hare. We're going to go through the different items so that people are aware of what psychopathy that we measure on our day-to-day basis and in our clinical work. So I'm going to kind of throw it over to Carl, who has been doing psychopathy assessments for a very long time and some of his understanding with psychopathy as well.
Jason, I guess if you make hay while the sun shines on days like this where it's cold and wintry, I guess we make podcasts.
Yes.
But yeah, we talked a little bit about last time of the differences in the term about sociopathy, antisocial personality disorder, and psychopathy. And one of the important pieces after we did that, I went and looked on YouTube on several of the things that are posted. And a lot of these things come out with 7 indices of psychopathy, 5 signs that you're dealing with a psychopath. What I'd like to say about that is that this is misleading because really psychopathy isn't reduced or narrowed down to one specific trait. It's actually based on having a combination of different traits. So you really need several of these in order to be considered a psychopath. So if we're looking at those things, largely if they use the word in these YouTube things, sociopathy, what's the difference between sociopathy and psychopathy? And they're looking at signs of psychopathy. They may hit on something, but more often than not, you probably can discount those, looking at those or looking further into them. Because psychopathy is a combination of traits. It's just like the idea of things like sexual sadism or anything in psychiatry and psychology. There's not just one thing, and certain things are traits and certain things are syndromes. There was a guy that was a sadist years ago that I assessed. He was an older gentleman in a forensic psychiatric hospital. He was psychotic. He had a schizoaffective disorder, which just has to do with an affective related psychosis of which he would hear voices and such. When I saw him, he was well medicated, so he was stable. But he would say he was very polite when you talk to him, no grandiosity, just very flat affect and sitting there and talking. He would often ask the staff, hey, does Dr. Carl need to see me today? So, he liked the human interaction and he was a lonely old guy. On the other hand, when interviewed about kind of potential sadistic issues, I'd ask him one time, I said, well, Mr. So-and-so, I want you to be honest. If no one was here, what would you do to that nurse in the other room if you wouldn't get caught? And he says, well, Dr. Carl, what I would do is I would tie her up and I would pull out her fingernails one at a time. He said this with no affect. So you can get certain traits like sadism. You can get certain traits that might have to do with narcissism and so forth, but that does not necessarily mean that you're dealing with a psychopath. What I would always caution people and reinforce in the audience, however, if you have extreme emotional reactions to people, never discount your emotions. If you have that kind of fear in the pit of your stomach or the hair on the back of your neck stands up, are you dealing with a psychopath? Are you dealing with someone who's psychotic and mentally ill and has a very primitive internal world? You are picking up on something, but exactly what you're picking up on has to be determined with further assessment and further consideration. Okay, given that as a background, we talked in general last time that psychopathy, as opposed to antisocial personality and sociopathy, has basically 2 primarily clumps of traits or cluster of behaviors. And one correlates with behavior and the other correlates with things that are more trait-based and often having to do with narcissism or hysteria or one or more of the other personality disorders. So as we begin to talk today, Jason, we're going to talk a little bit about Cleckley's criteria, who wrote The Mask of Sanity. And Cleckley was really the one to kind of outline these traits and talk about them as a group of items. Later, Bob Hare would use these traits and expand upon them to develop the Hare psychopathy checklist, which is what we use to assess psychopathy. But let's go over a few of these together, Jason, and maybe just talk about them to highlight them and let folks know an explanation as to what they mean.
Of course, yeah. So we can kind of start with superficial charm and good intelligence. So the good intelligence, you know, I think that's a misnomer and a myth too, right? That all psychopaths have this high intelligence or score very high on um, IQ tests and stuff like that. I know in our female data, the IQ was average. It was, 100. So I would imagine it'd be average intelligence within this population as well.
And even low intelligence.
Even low intelligence, correct. Yes. Yeah.
So probably Cleckley put that in, Jason, just to let people know that psychopathy wasn't due to being mentally retarded or a specific intellectual deficit. Yes. But you're exactly right. You get them in all IQ levels. In fact, often, if you combine this superficial charm and you throw in a little grandiosity, often people attribute more intelligence to them than they actually have. For example, years ago in the unit, we had a guy that was a psychopath and everyone thought he was really smart, but in actuality, he was only high average IQ, but he appeared smart. And think about it. What if you and I took our intelligence, which both are pretty bright, well above average, and we spent 24 hours a day practicing picking locks? Our ability to pick locks would be very high, but it wouldn't be a correlate of our intelligence. It would be the persistence in learning an illegal skill or behavior combined with the IQ. So that grandiosity or glibness in these people, which they're charming, we could throw in and use the word here, often a higher IQ is attributed to them than it really is based on assessment.
Correct. Yes. Yeah. It's just that feeling that they have this good intelligence versus actually when we were to assess it.
Well, people tend to project things onto them related to the charm and grandiosity. Oh, they're likable, perhaps, except when you get to below the surface. So they must be intelligent.
Correct.
So
all right. Let's move on to the next one. Yeah. So absence of delusions and other signs of irrational thinking. I think this is an important one. You want to kind of comment on this one, Carl?
Yeah, I think Cleckley put this in. And notice how I can see where this is going. We're often talking about Cleckley's intention versus the actual wording here. I think the importance of that was the idea that psychopathy was not caused by a mental illness. So it was not caused by delusions. And when they say irrational thinking, well, how do you define criminal thinking? It's purposeful from the criminal's perspective, but would it be considered rational? Well, from their point of view, it is, but objectively speaking, from a normal person, we wouldn't consider it to be rational. So, yes, I think Cleckley put it in related to that. Now, the one caveat here is even in the DSM, or Diagnostic and Statistical Manual, you can be both psychopathic and psychotic. In fact, one of the most dangerous, frightening guys I ever interviewed was he was a mission-oriented serial killer, which means that he was going around and he had in his mind it was his job to rid the world of homeless. So he was slashing homeless people, their throats in a large metropolitan area. Now, he was also paranoid schizophrenic. So when you combine those two and you sit in a room with that type of individual, it's very frightening. But the run-of-the-mill psychopath and everything is not psychotic. They're doing things from their perspective that appear to be rational and self-serving. From our perspective, it may seem odd or strange. I think about a female serial killer too. While the person was having oral sex with her, she shot him in the head with a .22 caliber pistol. Now, then she cut off the head. Now, besides the sadistic elements, if you know anything about forensics, if you use a small caliber weapon, the sound is less. If you cut off the head, you take the bullet with you because the bullet will not exit the skull. So you have no forensic evidence. So a lot of times we look at these folks and we may think that their behavior is crazy, so to speak, but it isn't.
very calculated and very manipulative and thought out. So yeah, so definitely a big thing. Yeah, that I think Cleckley, I think you hit that right on the head of what he was trying to get with this. All right, and then we can kind of get into absence of nervousness or psychoneurotic manifestations, but also kind of goes with lack of remorse or shame, as well as general poverty and major affective reactions.
See,
Um, yep, go
yeah,
ahead, Carl.
some of these, Jason, as you know, they would have been considered by Hare having to do with shallow affect, general impairment in affect. And Cleckley's idea, the same thing here, where these people, many of them are very detached. In fact, one of the things we find in our data, particularly with the males, not so much with the females, is the absence of these Rorschach variables that would have to do with attachment neediness. In fact, in like a sample of like 38 psychopaths, this kind of indice, I think there was zero or one psychopath produced one, with sexual psychopaths being different. So they have a lack of attachment, generally a lack of nervousness. You'll ask them about love, and they'll often say, well, no, wait a minute. And they'll give you either a definition that would have to do with right out of the dictionary, or they will just show a lack of understanding. I remember one psychopath I interviewed when asked about, has he ever been in love? He was puzzled. He looked at me and they says, well, you know, doc, I'm not really sure, but you know, when my child was born, I told this person, I said, I'm kind of having these kind of feelings. And the person said to me, oh, that's love. He says, and then he said, okay, I must know what it feels like to be in love. So they'll either give an intellectual description or they'll show a lack of understanding.
Exactly. And I think again, love is not the only one that they totally can't kind of get. Shame, remorse, guilt, all of those things play a role with it.
Well,
The
yeah,
main
Jesse.
thing that you
Yeah,
talked
go ahead.
about too with the females, the major affective reactions. Obviously, in males, we see a lot of that cold, kind of callous, kind of uh, no kind of emotion. But the females, they give the presence of this huge emotional kind of reaction. But when you kind of delve deep in it, it's kind of shallow and things like that. So that's where, if you see her crying or saying that she's has this guilt or remorse, you would think that maybe she feels things, but not necessarily. So there definitely is some poverty, even for the females with that one. Just not what your eyes are seeing. Just kind of delving a little bit deeper with that.
Yeah, sometimes with the women, when you bring that up, their presentation will be one of kind of emptiness and superficiality as well. I mean, there was a good podcast I watched on a teenage serial killer on YouTube, and she just came across as somewhat childlike, naive, bland, empty. Versus then you look at that movie. What was the movie Monster that was based on that female psychopath, which is
Yeah,
a pretty good
yeah,
of it. It's a little bit different with that angry kind of presentation and superficial affect.
yes, yep, 100%. All right. So, did you want to talk anything else about the emotions or anything like that? Feeling?
I don't think so. We might just mention the ones that go into that: the
Yep.
absence of nervousness, number 6, the lack of remorse and shame, and also number 10 on the list, general poverty in major affective areas. So yeah, but I think we kind of touched on the affective
Yeah.
presentation.
All right. So obviously, too, with Cleckley, we have the unreliability and untruthfulness and insincerity. Um,
Yeah, this can be
unre
quite. Yeah, this
Go
can be
ahead.
striking. What Hare calls this pathological lying. You get everything in the male psychopath, and then you can juxtapose as it is in the females. But in the male psychopath, you get everything with them intentionally lying to pull one over on you and set up a manipulative cycle to just a blasé kind of relationship to their lying. For example, here was a psychopath I was interviewing, and I was doing a demonstration for his treating psychologist, and he began to tell me about his service in the military. He says, yeah, doc, I killed 20 people. I cut off their ears. I brought the ears home as trophies, blah, blah, blah. And something was fishy about what he was telling me. And I said to him, well, what was your favorite weapon, of which he couldn't identify? He couldn't tell me the difference between hollow points and, different types of ammunition. So I turned to a psychologist. I said, has this guy ever been in the military? And the psychologist says to me, no, there's no record of that. So I turned back to the guy and looked at him. He shrugged his shoulders and just went on telling me some other bullshit. So, I mean, it can be like that. There can be an intention to pull one over on you, or it can just be because they're bored and they really don't care about your reaction to it.
Oh yeah, that especially dealing with psychopaths in prison, it's mundane. It's the same thing every day. Someone's now interviewing you. Now, yeah, I'm gonna tell this story and see what kind of reaction I can get out of you. Exactly what happens, and then that's why when we'll get into the how we do the PCL-R, why we don't just take their word for it.
No, amen.
Exactly. All right. So
It's often a shock to people, Jason, that people in institutions may not be telling the truth.
yeah, they just take their self tell unfortunately, we've worked in the day-to-day basis. We know kind of the things that go on, but you have just researchers that come in for maybe an hour, interview them, and just accept everything that they're saying is the truth versus, oh, look, somebody wants to talk to me. I'm going to pull one over on them today, or I'm going to tell them this really harrowing story that doesn't have any validity and is totally unreliable. So yeah,
And
so
often, if the
that
if the
often
goal of the lying isn't to impress you, another common goal is to make themselves appear as a victim. The criminal personality idea. That's, oh,
yeah,
woe is me, and this and that happened, and so forth. And then you check the validity of their statements, and they're often false.
exactly. So yeah, so we get a lot of the unreliability, untruthfulness, and sincerity with these individuals. So let's go through some of the other ones. Inadequately motivated antisocial behavior. I think that kind of goes with failure to follow any life plan. Um,
Just, I think so too, Jason. There's a correlation between these. As you look at somebody like Charles Manson, much of his behavior, if you really study the history and outside perhaps of the murders that he was, I guess, charged and went through the criminal proceedings for, it's a daily lifestyle of kind of impulsive, poorly planned, illegal activities, selling drugs, stuff like that. So there's large components of the life is just poorly planned. Um, and you couple that idea with the grandiosity. Here was another psychopath I interviewed. And I said to him, I said, well, when you get out, what are your long-term plans? He says, well, Doc, I'm going to be a corporate lawyer. Now, I said to him, I said, look, man, do you have your high school diploma yet? No, I didn't get that yet. Well, what does it take to be a corporate lawyer? Well, I'm not quite sure. I think they have a business school I can go to for that. And after about 20 minutes of asking about his plans, which had absolutely no planning, he had been out of an institution 1 year in his adult life around age 32. I finally said to him, you know what? I'm not quite sure that this is going to be the best plans for you, but you do have traits like many of the lawyers I know. At which point he first got pissed at me, but then when I explained it, he began to laugh. It was obviously a common joke, and with criminal attorneys, he kind of had some agreement about the issue.
yeah, yeah, that was a good example. I had a female offender who was in for a sex offense, and she didn't have, it wasn't a life sentence, maybe like 15 or 18 years. And I asked her, what's your plan when you do release? And she said, I'm going to go work at a daycare. And I said, are you allowed to be around children? She had no planning, just figured, yeah, when I get out, I can go work with kids. The sex offense, was towards a minor child. And again, thinking that there wouldn't be any issues with that.
Or
So,
examples demonstrate something else that's important, Jason. When you get past the first line of questioning, there's generally no depth or no thought. One guy told me about this. I said, well, when you get out, what's your plan? Well, I'm going to go to business school, this and this. I'm going to live with my sister. And then it all sounded good. But then the next line of questioning, when's the last time you contacted your sister? Oh, it was a couple years ago. So he doesn't even know if she's alive. The other question was, well, is that school near where she lives? Well, I don't know. I haven't checked it out. Well, what would you have to do to get into a school like that? Well, I'm not quite
Yeah.
sure.
Yeah.
So it's that kind of it's you can begin to see as we talk about this for the audience how superficiality and how
Hmm.
all these traits combine in any one kind of behavior. It's not just one thing on the list. There's a whole
Yeah.
thing that goes into the way they respond and present themselves.
Exactly. Yeah. And there, there's a lot of overlap. There's a lot of things that we see, and once we get into the PCLR, we'll talk about some of those things as well. So I think, yeah, like inadequately motivated antisocial behavior, failure to follow any life plan, poor judgment, failure to learn by experience. I think we kind of mentioned that. But specific loss of insight kind of could go with maybe poor judgment or how they kind of view themselves. And I know, Carl, you have some good examples
Yeah,
about the
because
specific
this is
loss of
such an
insight.
important one. And this kind of thing, you can get that kind of trait in many of what we call the personality disorders, these kind of ingrained patterns of behavior that you see in adults, where their thinking may be irrational, they don't learn from experience. And really, this one has to do with projection. Simply stated, the psychopath can see things in other people that they can't see in themselves. And think about even groups of people in our society today that this is a core characteristic. Oh, you're haters, you're this, you're that. But really, they're the ones doing it. And you can also see how this is a real detriment to learning, change, or treatment. If basically I have no problems and all the problems are in you, or everything that's wrong is with the other, how in the world are you going to take any time to look at yourself and be thoughtful? Most of us in the audience, and you and I, Jason, we all have some anxiety and our neurotic issues. We're more likely to go through life blaming ourselves for all the problems in the world and thinking we're the cause of it, we need to change, and that kind of thing. But no, the criminal and also many personality disorders and the psychopath may share in common this kind of projection and blaming the world for their problems.
Yes, 100%. So they are always uh they're the victim. Everyone's out to get them. Uh
And
and
there's nothing
uh
wrong with them.
and
No,
there's
you're
nothing
the one
wrong.
with the
Yeah.
problem. See, normal neurotics, we go into treatment because we're feeling bad, we want to change, and we're upset with something about ourselves. But these kind of people don't go into treatment. They're dragged into treatment only when the criminal justice system says they have to go, for the most part. I can remember years ago working in a county jail, and I would try to do treatment in the community because, as we all know statistically, you're more likely to reduce the idea of relapse if you get help for the first 6 months or so when you get out. You can't just throw someone out of an institution into the world. But when I first started the group, I would have one or two people in my probation group. No one would show up. I was doing empty chair techniques with no one in the room. As soon as probation, I had it set up through them that they were mandated to go. Then I had 12 to 16 people in the group all the time. They're not likely to seek treatment unless there's some external pressure to do so.
Because they don't have there's nothing wrong with them. Why would they don't need to change with therapy? What's that?
The problems with the world around them.
Exactly. All right. So we talked about specific loss of insight, pathological egocentricity, incapacity for love. That can kind of also go with sex life, impersonal, trivial, and poorly integrated, as well as unresponsiveness in general interpersonal relations.
Yes, you're
So,
dealing with their grandiosity and their lack of attachment.
yes, yes, 100%. They don't really, again, there's nothing wrong with them.
So the
Uh,
main takeaway from this, Jason, the way we're going over this, is in our examples of how these characteristics are intertwined and relate to each other. And it's not just one thing. You have the
yeah,
superficiality with the shallow affect and lack of kind of emotional attachment. You have the grandiosity with the projection and the whole world's to blame and so forth.
and it's just not just one example. Multiple examples in multiple areas that we are looking at and assessing. All right, and then lastly, I guess these have kind of kind of dropped off, but it kind of just talks about, I guess, manipulation and their impulsivity. So fantastic and uninviting behavior with drink and sometimes without, as well as suicide rarely carried out.
Yeah, some of these are not the most descriptive, but when you put them all together, Cleckley really did. He did the first-rate job of putting together criteria for psychopathy. Several people in research used variations of this for identifying psychopaths in their research studies.
And he put this together almost 80 years ago now, or over 80 years ago, which is kind of hard to imagine. So
anything that long ago is hard to imagine, Jason. It's
so
getting closer to imagine, though.
it is. So Hervey Cleckley, again in The Mask of Sanity, started proposing these criteria for psychopathy, and then Bob Hare took on some of the items, added some stuff, changed some stuff around. So the most recent PCL-R manual came out, so the psychopathy checklist in 2003, but dates back to the 80s and 70s of him doing all his research. And when we're going to look at the PCL-R items, these were what we talked about last week. Each of them are scored from 0 to 2, 2 being the most, 0 being absent. We're going to look at a whole bunch of records. We're going to talk to other people. We're going to look at if there's videos or things like that of the person. We're just not going to take the person's word for some of these things, because 3 of them, or at least 2 of them, pathological, lying, conning, and manipulative, are in itself not. If you're going to score them high on those, they're probably going to be causing you problems in the interview. But we can get some good real world behaviors to see how they are interacting in the interview that we would use to kind of score the PCL-R. And Carl's done this for a long time. So what would you like to kind of talk about in general before we get into the items about the PCL-R,
Yeah,
Carl?
I think, Jason, I want to talk a little bit about the scale itself. Not a whole lot, but just precursory, because in the upcoming weeks, this is going to be the backdrop for everything we talk about. I mean, we got one of our colleagues, Ten Kudliff, coming in a few weeks, going to present a case on a female psychopath. We got our colleague that evaluated Charles Manson is going to come in, and we're going to talk about our work and what we did with evaluating him and his Rorschach protocol. So the idea of psychopathy, and pretty much what we're looking now, will be the backdrop for everything we discuss from here on out. But the scale itself, as Jason mentioned, you can get a 0, 1, or 2. So if you look at the 20 items, 2 would be a maximum of 40. Generally, a cutoff, when you get 30 or above, there's a real high likelihood that you fall in the group of what would be considered to be psychopathic. It's not a diagnosis, it's a category, and it puts people at risk for many problematic behaviors like misconducts in the institution, reoffending quickly, violent reoffense, and so a failure to participate and successfully complete treatment and so forth. So it's a very important kind of variable. But the way the PCL-R scores, it's scored both from record review to get the background data for the items, and then a clinical interview, in which you get a sense of more of the trait-based kinds of items like grandiosity and glibness and so forth. And this was real important that you can also, if you have enough data, you can actually score somebody with the PCL-R, the Hare Psychopathy checklist, on just record review. I used to do probation training, and I did there'd be 30, 40 people in a group, and I would train them to understand psychopathy and how to do the checklist. We always used Ted Bundy and Charles Manson because there was a lot of available books written on them with background data, and there was also a lot of tapes with them being interviewed. So you could really get a sense of the trait-based items for this. So it can be scored reliably without ever interviewing someone, although it's not the preferred method. You always do the record review first because they lie. So you want that documented data, and you can often use that during the interview. A lot of things psychopaths are not readily going to talk about. For instance, two typical questions that I'll ask sex offenders, particularly those that have Well, one guy that I interviewed was a psychopath, and he was a sex offender. He had strangled several people, including they were girlfriends and such, which is unusual behavior. If you think about it, if you're going to attack someone impulsively, you'll pick up a knife, you'll hit them with a hammer, you'll punch them, but you won't kind of strangle them. That's a rather unusual behavior. So I got to a point where I was interviewing about some items, and then I said to him, I said, well, when did your violent rape fantasies begin? Which is a question he had never been asked before. And before he knew how to answer, he said, well, yeah, at about 13, I started to masturbate and had these violent fantasies. And then you could see him after he told me about it, begin to think, I really shouldn't have said that, but it was too late. So another strategy when you're interviewing and thinking about using these items, and particularly sex offenders are good examples because you ask them questions that would be rather unusual. One of the questions you ask sex offenders is, have you ever had sex with animals? And of course, as an evaluator, you're thinking, when they take time to answer, you're thinking to yourself, hey, the answer is no, man, what the hell are you thinking about? But when they start thinking, I can remember one guy said to me, he said, well, Doc, I never did. This one little dog sure looked cute. I'm thinking, what the, so as an objective human being, you have these thoughts that you don't reveal while you're interviewing. So the interview brings out valuable information, but the PCL-R can be scored without it. So given
Yes.
that,
100%. Yeah. So, especially with the females, though, being a little less indirect is always a good way to kind of go about it. Playing like you don't know the information, like you've done your record review and maybe their crimes that they've done, and then ask them, oh, it says here this, what happened? And kind of how the uh, criminal record was or what the actual information was, and just playing kind of a little dumb, like a little bit like naive. And it kind of, again, opens up a little bit more, especially when interviewing females, more so, I would say, than males.
You can never go wrong to a certain extent with that approach, Jason. Even with the males, what you can do is you start the interview with the purpose of the interview. Well, they have all this stuff written about you and so forth, but I'd like to hear your side of the story. So, I mean, you can it's a good interviewing strategy, even more so females. And when we think about the PCL-R, as we go over the items, remember there's two major what we call factors. That means clusters of items that are related. The one is behavioral sorts of things that correlate with antisocial personality disorder. And the other is the more trait-based issues and criteria which correlate with narcissistic personality disorder in men and histrionic and borderline disorder in women.
Yes. So we'll go through the items now. We'll talk about them. There's some overlap, obviously, with Cleckley. So, but we'll go through the different items and kind of give some insights into it. So again, a lot of our examples is because of the people that we worked with, criminals, people's in prison or forensic psychiatric hospitals, probation, stuff like that. Obviously, we talked about last week, or our last podcast, was that Bob Hare estimates about 1% of the population is psychopathic, at least in the United States. So that is a lot less people that are in prison. So these are not always people that are incarcerated. So it could be anywhere that you interact with. And I know we've talked about, or we've mentioned Babiak's work with the success or the corporate psychopath. Those would also be kind of some of the information about that. But let's get into the items and kind of go through this. So glibness, superficial charm, we kind of talked about a little bit with Cleckley. Anything else you want to add to this one, Carl? Or
no, I'd offer the caveat to people is some of these titles or item descriptions are not what they think they would be. In this case, it probably is. The gift of gab, the used salesman, the BS person. So yeah, I think that one's self-explanatory.
Then grandiose sense of self, again, the God gift to the earth, I am this all-powerful being. Everyone needs to kind of worship around me.
And in the criminal sense, the added piece is kind of the failure to kind of understand their impact of their behavior on their victims. Like part of grandiosity is they kind of deserve that, or they had it coming anyway. I mean, one guy told me that, what did he say? Oh, well, yeah, I did that to him, but you know what? I really did him a favor, because if I did this, he won't make the same mistake in the future. So see, that's it. There's that little bit in the males, that colder piece of the grandiosity.
Yeah, and I think I had one female that like killed somebody that said, asked them how she felt, and she's like, "Well, he's dead." Like, you know, you know,
Class,
you know? Yeah. Okay. So, all
no,
right.
no
So,
sense in wasting any feeling about that. I mean,
no,
it's
he's
over and
dead.
done with.
Move
Yeah,
on.
they'll often say that too, Jason.
Yeah.
Well, it's over and done with. I moved
Yeah.
on.
Yeah.
Something to that effect, they'll often say. And that's
Yeah.
part of that grandiosity.
And then when you ask them, like, go back to like the lack of empathy or remorse or guilt, how did it affect their family? I don't know. Who
Yeah,
cares? I did him a favor. That guy
that's
was
it.
X, Y, and Z, right? So,
And see, and those statements are part of the grandiosity, but they
yeah.
capture the lack of remorse, the impaired empathy, and
Hmm.
and failure to take responsibility for behavior, which are
Yes.
all would be on trait-based items. So in the
Yes.
same way we talk about Cleckley's items as related, you can begin to see that these items are related.
Yes. One, very, yeah, we're going to talk about that. Like one and two, kind of cluster together. All right. So three, need for stimulation, proneness to boredom. That was, I guess, a little different than from Cleckley's stuff. Um, kind
Yeah,
of mentioned that. Yeah, go ahead for it, Carl.
yeah, they're always on the go. They're bored,
Yeah.
using a lot of drugs, doing things just for the thrill of it. They'll
Yeah.
even do burglaries and break into houses just for the fun of something to do, stirring crap up. They'll talk about living on the edge or always being where the action is. So that's
Yes.
the thing in males.
Yeah, females would be kind of the same way too. Very impulsive kind of ways. Proneness to boredom. They don't like what they're doing. They'll do some relational aggression, and then or spread gossip or rumors in the unit, and then just sit back and watch it play out and enjoy the show
There you
for
go.
that. Yeah.
That's excellent. Yeah.
Yeah.
Enjoying the show. They stir up the crap and then enjoy the show.
Yes. Pathological lying. We kind of talked about
We
that.
talked about that.
Yeah, cunning and manipulative.
Well,
Similar
this
lack of remorse and guilt. We can kind of talk about those.
Yeah, the only thing with the conning and manipulation you'd add to it is kind of the welfare scam and
Hmm.
fraud, and particular things related to it. Other than a lot of the manipulation is self-serving or because of the boredom stirring things up.
Yeah. And then the lack of remorse and guilt. Again, they don't really know what that is. They very difficult to kind of process that.
And the
Uh,
similar comments we made about grandiosity, they had it coming.
yeah.
What was the effect of your behavior on the victim? I shared this in the other podcast. This was a guy, a sexual murderer. Well, the bitch bit my finger and it hurt for 6 months. That was his answer in what was the effect of your behavior on your victim. Self-centered, absolutely no remorse.
Yes. Shallow affect. We kind of talked about that. No depth to it. Callous lack of empathy. A little different when we talk about females. We're going to kind of see a little difference between males and females. But what's the callous presentation you see in males a lot,
Yeah,
Carl?
the thing with the males, the callousness that gets added to the lack of empathy, or like you said in the females, it's really a degree of, for the most part, a degree of not having empathy. With the males, it's a sense of overkill, kicking
Yep.
people when they're down, breaking into houses, and not just doing the burglary, but thrashing the house. It's this overkill. In a fight, they'll just, they'll keep going. They won't stop. Um, it's just the abusing animals and things like that. We'll get into that, and sadistic treatment of animals. So we get a little bit in this item at times, the sadism.
Yes. So parasitic lifestyle, they can work, they choose not to, they find ways to do the quote unquote easy or lazy kind of way of thinking and behaviors. Um, we'll get into that with the females. It looks a little different, but
That's
parasitic lifestyle.
They support themselves through criminal behavior rather than responsible behavior. They borrow money take money from family. They'll often use the excuse when you ask about a behavior, oh, I needed money for food. Well, You were working at a job. What the hell happened to the money you had at the job? Well, I spent it on drugs. Well, it doesn't fit together in a rational perspective, but a self-serving one. So yeah, they'll steal from family. They'll always reminds me of Angel Martin on the Rockford Files. That guy was an annoyance. I know most of the audience is probably too young to know that. But every episode he shows up taking advantage of Jim. It's the same thing. All kinds of scams. That's what he lives.
Yeah.
There's a scam every episode.
Yep. Yeah. So parasitic lifestyle, not doing the kind of the honest way of making a living. Poor behavioral controls. That's a pretty big one.
Yeah, it's basically impulsivity with behavioral controls, and it can evolve aggression. So it's basically just that weakened controls, and then it would include around aggression.
Early behavioral problems, and we can kind of talk about that with juvenile delinquency, which is 18. So this is where you get a lot of the myths, or I guess not myths, but a lot of things, harming animals early, or doing some of the, conduct stuff while in juvenile. So early behavioral problems, not necessarily getting arrested for it, and then juvenile delinquency obviously would be
Yes.
formal charges and things
In
like
the early
that.
behavioral problems, we include substance abuse. But remember, when we say we include that, that would not be enough for getting a 2 on this item, because people do substance abuse in behaviors for different reasons. More often than not, it has little to do with psychopathy. But for each of these items, you're going to look at a number of things that would contribute to the scoring.
One of the things that we've kind of found in our research and our interviews with females, early behavioral problems, the kind of way that it's written, um, especially adolescent or young girls don't necessarily engage in physical aggression, but there's like a lot of relational aggression and gossip. That kind of mean girl kind of presentation. That if you're not really looking for it, you may miss it. Like if you're looking specifically for physical violence against peers that males or young boys may have, you may miss that a little bit with the females. So that's an
Exactly,
important thing.
Jason. What makes me think when you say that, Jason, is that when you do get those typical things in girls that you see with the males, this becomes a much stronger indication of psychopathy.
Yes.
Because you
Yes.
will, on occasion, you'll get this, as I said, the teenage serial killer that was on one of the YouTube videos. She had sadistic behavior and all kinds of things as a kid. So when you get those things, that becomes stronger evidence and a warning sign that you want to assess further.
Yeah, and I had great that you mentioned that point. Yeah. So there was female psychopath that I interviewed. This is probably like the youngest, and she was arrested for this. I think her brother and her neighbor and herself were on the trampoline. The neighbor like maybe told her to get off the trampoline. She didn't like that. She was 5. She took a 2x4 and smacked him in the back of the head, and so if you're having that at 5, it's not surprising then
That's not a good
all the
sign.
other. It's not a good sign. Yeah, yeah. I'm surprised. I wasn't surprised when she was in prison. So yeah. So
That
early
behavior
behavioral
is not
problems.
generally indicative of mature adult relationships that are mutually cooperative.
No, not at all. All right. So lack of realistic long-term goals. Um,
It's
we
like the
kind of talked
Cleckley.
about that.
Yeah.
Yeah. Yeah, we kind of talked about that, failure to learn from experience and
They
stuff
may
like that.
present something they learned in an institutional setting that indicates that their plan sounds realistic. But like I was sharing with some other things, when you go beneath the surface and ask a few more questions, it falls apart. It doesn't hold water.
Yeah. Impulsivity, failure to kind of control themselves, kind of go with that behavioral control.
This is an important one. It
Mhm.
differs from poor behavioral controls, which may have to do with impulsivity related to aggression. But this is generalized impulsivity, doing things on the spur of the moment. And we can see how this links to the proneness to boredom. And they're both on the same factor, the ones that's behavioral.
Yes. Yeah, and again, not really thinking things through. Irresponsibility, failure to accept responsibility for their own actions. Kind of talked about those. Everybody else is out to get them. They're not the reason. The person that I murdered, he made me, murder him, and I did him a favor. Goes back to the grandiosity as well.
The
And
irresponsibility, they get fired from jobs. They don't show up for work. They use substances at work and drink on work, and so on.
yeah, many short-term marital relationships, we can kind of talk about that with promiscuous sexual behavior, just problems with relating interpersonally with people.
And for people assessing this, the psychologists and so forth out there, you want to carefully analyze this. And also with women, I think there's a caveat here. But with the men, one male psychopath, well, how many relationships did you have during this 6-year period of time? Well, he told me for 3 of the years, he was living with 3 different women at the same time. He would spend 2 nights at the one person's house. He would spend a week later on at the other person's house. And the caveat was he had clothes at each person's house. So they were like he was living with these people. And then, of course, the question, well, did this woman know about the other one? Well, no, I didn't ever told her. That's the classic, but you really have to carefully assess what constitutes relationships. And what about with the women, Jason? If you're thinking of what I'm getting at here, what do you often include with women for their relationships?
Well, yeah, you figure out like specifically what is a relationship for them. They tend to kind of have a little bit more long-term relationships, but again, there's a lot of problems in it. And then they would also like to, when they come to prison, right? They wouldn't consider those if they get into a relationship while in prison. They wouldn't necessarily kind of count them when you're asking about them. They're only kind of thinking about
There you go.
maybe in the community as well. So when you get
But
to,
we would count them in scoring
we
the
would
item.
count them. Yes.
Yes, that's it.
Um,
They'll
yeah.
have additional relationships in prison.
Or pen pals.
Yes.
They they may have like 6 or 7 different pen pals, and they better hope that the pen pal comes on the right day for visitation and not at the same time. So that could also be, something that they present as well.
Well, that's with their male relationships, but they'll have actually
Yes.
like female relationships that are
Yes.
actually relationships, like if you were living with someone in the prison.
Correct. Yes. That is
Yeah.
also something that is there as well. So we talked about juvenile delinquency, revocation of conditional release. Those would be things like escape, failing probation or parole. Those are
Failure to
kind of
appear.
failure to appear. Those are all things. Obviously, those would be people if they're not arrested or this is the first time in prison, they may not have some of that. So, it might be difficult to assess that one.
And then criminal versatility is straightforward. It's just the variety of crimes they commit. Sexual offenders may only have committed sex offenses, but they may have done 100 of them. So they won't get scored the same way as if you've done 8 different types. Now, the thing to remember about this is when you look at these YouTube videos, the 6 signs of psychopathy, the 9 signs. Like I said, for some reason, they tend to always go in odd numbers. I don't know why that is. But really, when we're talking about someone who's psychopathic, we're looking at a combination of scores on this scale. And this is the only valid scale for assessing psychopathy. And we're not calling everyone that's narcissistic, paranoid, or borderline, they're a psychopath because we don't like them. No, we're objectively looking at the science and kind of this particular scale.
Yeah. And then one last thing I want to mention about criminal versatility. A lot of times, if you see a quote unquote serial killer, they must be psychopathic. But kind of getting to Carl's way, if they're only did murders, their only crime, they're not going to get a high score in criminal versatility. So we're looking at frauds, we're looking at drug offenses, assaults, murders, drinking and driving offenses, escape or failure to appear. It's a combination of everything for that. But yes, that's 100%. So we're going to use this tool. This is pretty much our backbone of all our clinical and forensic and research that we've done is using the PCL-R to identify these people. We use the score, we categorize them at times from 30 or higher. But it's just not just one or two of these things, as you just mentioned, Carl. It's the combination of everything to assess really what we consider a person, if they're psychopathic or not, or how psychopathic they are. It's based on these 20 items and scores from 0 to 2. So that's kind of pretty much what we wanted
Covers
to
it.
kind of show the criteria. Carl, any lasting comments or anything like that before we close out?
Yeah, just your wrap up, Jason. I think we covered it. This is our YouTube podcast that would be how you identify a psychopath.
Yes, it's more than 7 or 9 or 3.
Or
It's
11
20.
or 13. Always got to go with an odd number for some reason.
Yeah, and look at us. We just presented 16 and 20, so we're out of the game. So, well, I hope this was helpful for people to understand better ways to kind of assess psychopathy with some examples and explanations. Please continue to like and subscribe, comment on our YouTube, Inside the Psychopathic Mind. You can find it on YouTube, anywhere you get your podcasts. Send us comments, send us emails. If you go to maverickpsychology.com, there's ways that you can interact, send emails, learn more about the PCL-R if you're a person that is assessing these people. We'd be more than happy to train you on the use of the measure. So please follow us and hope you enjoy the episode, and we'll see you next time.
Yeah, thanks for joining us.